Good afternoon, everyone, and welcome. My name is Gary Parker. I'm the Associate Dean for External Affairs and the inaugural director of the Clark Fox Policy Institute. And on behalf of my co-host, Janet Gillow, who's the Director of Professional Development, we want to welcome you to this next edition of Open Classroom. What we're doing is, while so many people are locked in, we're opening our virtual doors, letting you inside the school, giving you opportunities of professional development, or even just learning something new about a topic that you've been curious about. Before we get into today's presentation and discussion, I want to introduce Dr. Sara Russell, who is a research scientist and professor at the Brown School and who is affiliated with the Clark Fox Policy Institute. And Sara Atia Thurman and myself will be joining Sara in teaching a class this summer. And Sara would love to hear a little bit about what we're teaching.
Yeah, great. So as instructed by Janet, I just want to give some dates and the formal name of the class. So the formal name of the class is the Community Organizing and Advocacy, the Importance of Community Efforts During a Public Health Crisis. We essentially took a class that Gary and Atia developed on community organizing, which was fantastic. And really are going to apply it directly to current events around COVID-19 specifically, but also public health crises in general, and really focus on communities organize grassroots efforts and really at the policy level to implement strategies to sort of address issues that arise during public health crises, but then also to talk about how some populations can be especially impacted, especially those vulnerable populations that may suffer unintended consequences from some of the policies that arise out of public health crises, and some that benefit more than others. So we're really excited about this class. It will occur Monday, June 15th, 2020 through Friday, June 19th, 2020. This will be an online class. So we're working hard to develop some really, I think, fun activities outside of just the lecture. We will have online class each day from 1 to 2:30, and then develop some additional out of computer exercises for you to work on and we're teaching in the class. So we would love to have as many people as possible, and really hope that we have some great attendees so that we can really take even learn from your all's perspectives and how you're going through this crisis at the time. I think we can all learn from the attendees. So I'm really excited about that, and I think that's about it.
Great. Thank you, Sara, so much. Really appreciate your time today. We know you have a lot going on at the school and with your research, and mother to two beautiful kids as well. So thank you so much for somehow keeping all those balls in the air and helping us push forward this course this summer.
Thanks, Gary.
Thank you. All right, now we're going to move on to today's presentation, Translating Research for Policy. It's being hosted and taught today by two of my favorite people. We have Dan Ferris, who is our Assistant Dean of Policy Initiatives and also helps lead the Master in Social Policy program. I met Dan for the first time in 2007, so we have a long history of collaboration, and hearing from him is a real treat today. And then we'll also be joined by Atia Thurman. Atia Thurman, also a Brown School alum, and she is the Associate Director of the Clark Fox Policy Institute, has a long history in communications and policy, and we're really looking forward to hearing from you today as well. So please give a Brown School Open Classroom welcome to Dan and Atia.
Thank you. So welcome. Thank you so much for that very warm welcome, Gary. We appreciate it. Dan and I have been working together for a couple of years now, and we're really excited to offer this to all of you who have joined us. So thank you for being here. Today we're going to, this is, I have to tell you, this is like a lifetime of learning that we're going to do a crash course in this next 45 minutes or so. There's going to be plenty of opportunity for questions. So please use the chat room. Again, I want to reiterate using the chat feature for questions, and we'll try to get to those mostly at the end, but we'll take a look at those throughout the presentation. So today we're going to start with setting the stage. We're going to go through a local case study, and we're going to talk about research as a tool for change. So that we're going to go through a lot really fast and furious, and we'll put a lot in these slides, and we're going to make those available to you. So the first thing we want to do is we want to talk about the role of research, practice, and policy. Nothing happens in a vacuum, and you all already know this. So practice doesn't happen in a vacuum. Many of you are probably familiar with evidence-based practice. That is the standard these days. There's also evidence-based policy making, and it really does start with research. So when we look at the complex social problems that many of us are trying to solve, whether from the research lens, the practice lens, or the policy lens, all three of these must be integrated. Just a quick show of hands, really quickly, how many of you align more with research? Okay, all right, good. I thought it was just going to be a small number. Great. All right, so we had about, okay, somewhere around 10 people align with research. How many align with practice? I'm expecting to see like a huge number around practice. Okay. Somewhere in the 20s or so for practice, and then about 24. And then how many align with more with policy? Okay, great. Somewhere around 20 as well. And then so somewhere I'm missing a sector for a group of people. But yeah, so this just want to emphasize that they all three coordinate together, that the best way to have evidence-based policy and evidence-informed practice is to start with research, and that's what we're here today for. Great. So we want to recognize that we are at this incredible moment in time in history that will never be forgotten for what all the lessons we're learning and all the ways in which we are prepared and unprepared for this. That is the global pandemic, COVID-19, that all of you are familiar with, which is why we're engaging with you in this unique way versus in person. So thank you. The thing is, we wanted to emphasize that right now, the cycle of research to practice of policy is happening at a pace that is unprecedented. It is happening so quickly and so rapidly, and it's been incredible. Just so you know, that pace is not typical of the cycle for research, practice, and policy. And just the way we feel the urgency right now of COVID-19, people who are everyday advocates for mental health, for children, for protecting families, for public health issues, every type of social challenge, they feel the same urgency though as we do right now in a global pandemic. So we want to be clear that as long as it takes to make change happen, we realize that a lot of people feel like the fire is now, and it's in their places of advocacy and where they're championing and where they're trying to change, that urgency is present all the time. So just just to give us a little bit of a picture here of how rapidly this is happening, but why it's so key, is that in the beginning, well, not in the beginning. So in the beginning, one of the first models projecting how many people might actually pass because of COVID-19, scientists projected 240,000 Americans. This is in the US only, okay? That if we did nothing, if we didn't act quickly, if we didn't use research to inform our practices, that 240,000 people could die from this disease. We are now, because of the research and because the research so quickly informed practices and policy, practices such as wearing masks, practices such as social distancing, practices such as closing schools, closing venues, all of that, including policies where governors had to issue shelter-in-place orders, where county executives were telling us to stay home, no gatherings beyond 10 people, beyond 50 people. The rapid pace at which we enacted practices and enacted policy is now looking like we may only have, and it's not only, it's still devastating, but it has reduced that 240 projected deaths to 60,000. I do want to be clear, 60,000 is a massive amount. And, you know, we lost a little less than 60,000 troops in Vietnam. And that was a war that raged years and years. But right now, in the height of the pandemic, US lives lost may be around 60,000 because of research informed practices and policies.
Thanks so much, Atia. So it's great to be here today. Thanks, Gary, for the wonderful introduction earlier. It is true, we've known each other for going on 13 years, and some of the things that I'll be talking today will reference some of the adventures that we've had along the way even. So we'll keep Gary entertained throughout the course of the presentation, to be sure. So why use theory? Why use models in research, in policy analysis, and policy advocacy? So whether you're in the role of a researcher, an analyst, or an advocate, using a framework can help to define objectives, set boundaries, and prioritize what can be significant amounts of information and resources and materials that you cull through. Also, following and documenting some kind of a process is really helpful for transparency, for community collaboration, and accountability to your stakeholders. If you are following some kind of process, whether it's in an advocacy model or a policy analysis model, what you're doing can be replicable, it can be shared, it can help to shed some light into where a policy recommendation might come from, what research you incorporated into your thinking, and then how it was used to affect change. So we're just starting off here with a couple of basics. As Tia mentioned, we're going to do a crash course in a lot of things in a little bit of time. So thanks for bearing with us, but please do send in your questions through the chat throughout. So all of this and what we're talking about today exists within what's commonly identified and referred to as the policy cycle. We find that research is at the center of this, which can inform each step along the way. I'll also mention and highlight that some research is conducted without policy in mind. And that's where today's topic and today's theme of translating research into policy couldn't be more timely and relevant. So there are dozens upon dozens of models of policy analysis. And sometimes people are following different models and they're not even aware of it. But one model that we wanted to throw out for consideration and for folks to keep in the backs of their minds as we're talking through a case example today and having discussion is referred to as the eightfold path. So pretty universally, models of policy analysis begin with problem identification. So clear and defined.
We're having some issue with your sound fading in and out. I don't know if there's anything you can do, but I just wanted to share that feedback.
Thank you so much. I'd push my earbuds in a little bit more, or switch it up. Can you give me a thumbs up? Is it sounding okay? Okay. If it peters out, I'll switch and just go to the computer audio, which will be more grainy, but it'll be there. Open classroom where the backgrounds are virtual, but the conversation and coffee is real. Just picking right back up. So problem identification being a pretty universally shared place for starting any kind of analysis. And the goal of policy analysis is informing decision-making and informing advocacy efforts that will help to affect policy change. So there isn't a lot of value in analysis for the sake of analysis. At the same time, which you see through a framework like the Eightfold Path or others, is looking to be as impartial and unbiased as possible when crafting a problem, when looking at different ways of accumulating evidence to make recommendations that could be put forward in various types of campaigns and strategies. So in addition to policy analysis, there's also theories of policy change. So these models don't exist in a vacuum, and we find that it's incredibly helpful for advocates as well as researchers and analysts alike to be familiar with why and when policy does change, either incrementally or dramatically due to large events or groundswells of support or otherwise. So one example we'll just highlight here today for some framing is Kingdon's streams and windows models. So the idea here, if you can close your eyes, or you don't have to, is that there are three streams: a problem stream, a politics stream, and a policy stream. And these three run independent of each other. When these three converge, when they meet due to varying circumstances and the incredible work happening by folks participating today, the window of opportunity opens and policy change can happen. So as we're thinking about policy analysis, it doesn't happen in a vacuum. but it is cognizant, but not necessarily driven entirely by policy change. But we'll talk about that a little bit more as we go through. And so a couple of challenges. So researchers and policymakers, sometimes they exist in different spaces. Sometimes they speak different language, sometimes literally. They have different motivations and incentives, different timelines. Sometimes evidence cannot be generated based on a legislative cycle, for example. In terms of some of the relationship building pieces between researchers, policymakers, and advocates, sometimes there's just turnover and churn in terms of who your point of contact would be in a legislative office or in a government office. Research can sometimes not be applicable either because it's out of date or because it was done somewhere else. And then of course, politics and ideology. There's facts and then there's facts. And so we'll talk a little bit more about strategies later on of how you can take evidence and frame it in ways that'll have the broadest appeal and the largest impact. I've learned from colleagues at the Social Policy Institute, Washington University, McCall Weiss, and others, this kind of staggering fact that it can take 17 years for just 14% of research to translate into practice. And so I think across the board, whether we're focused on practice or on policy, researchers, advocates, policymakers alike can be doing more and be doing a better job to connect with one another and incorporate evidence and research into the policy process. But it's not just about evidence and it's not just about research. Facts alone won't end childhood hunger. Facts alone won't end homelessness. Facts alone won't improve outcomes for the thousands of Missourians who don't have health insurance. What we find and what we really follow and prescribe to is not just rigorous research, rigorous evidence, but how do you translate that into policy is through this seamless intersection of research with storytelling. And so we'll be talking through an example now. I'll turn things back over to Atia to give some examples of how that's done in practice.
Thank you so much, Dan. So yeah, humans understand a lot through storytelling. Our brains are wired for that. And I want to tell you a little bit of story about early childhood care and education in St. Louis. So how many of you, raise a hand against, how many of you are parents? I'm gonna see this number like shoot up here, right? Okay, it's just gonna be a lot. And all of you were once children, right? Yeah, so listen. Here's what we know. We know now, after years and years of research, that early childhood care and education and the quality of it has a great impact on how children do in life. It forms a foundational beginning for a lifetime of success, and we're going to get into that a little bit later. But here's the story in St. Louis. We've got about 90,000 children under the age of 5 in the region who, and only about just over half of them actually have access to licensed child care facilities, okay? And only 19% of them have the subsidy eligible or have access to quality providers, okay? Also, the average cost is really high. If you paid for childcare, if you know anything about it, it's ranging from about 10 to 15% for families, when the federal government guidelines say it should only account for 7% of our income. If you are a working family and you have more than one child and you're putting them in childcare and daycare and you want high quality, you're spending a lot of your income on that. And also there's a racial disparity in the region in terms of about 38%, white children are about 38% more likely than Black children to be enrolled in pre-kindergarten programs. And we know how important they are for school readiness. So this is a story that's been happening in St. Louis for a while. This isn't really new, but it's been building up. And so what I want to talk about is, again, the timing. As we're telling this story about child care in St. Louis and early childhood education, I want to start with For the Sake of All. And For the Sake of All came out in 2014. And maybe if you're from St. Louis, you're familiar with this just landmark report that came out about really health disparities. But in it, it said that the lack of quality early childhood education was a leading indicator of health disparities between white and Black residents. And then just a year later, we have Ford through Ferguson come out with their report the commission comes out with the report with 189 calls to action, one of which prioritizes early childhood education policy as a call to action for youth at center. And then a couple of years later, we have a group of people who come together and they're like, this is really an issue. And this is also a way in which we can address some disparities and inequities in St. Louis is through high quality early childhood education and care. And so then IFF, and along with 22 organizational partners, take on this look at the data. What is the data here in St. Louis? What does the story tell us about who has access, what that access is like, what the quality is like? And then from there we have, and these are all 4 reports that you can get online. From there we have WePower, which is a powerful power building organizing organization. And they organized a group of Tomorrow Builder Fellows to create a process that really outlined, took community input and took research and said, here's a process for how we can redesign early childhood education in St. Louis. Great. And then I want to talk a little bit about what it means. So you're hearing a lot about research and the story and what the story tells us and then what we should do about it. And in the policy cycle that Dan just went over, problem identification is one of the first things. So when I talk to you first about how many slots of early child ECE we have and how many we don't, who has access to it, what's quality and what's not, that's all part of problem identification. And as you can see, it actually takes many years sometimes to really understand the problem and get to the root of it. Then as you're thinking about the problem and you're thinking about possible solutions, you have to involve the communities that are most impacted. This is the only way to do things nowadays. We can't, there was a time when we could look at a problem and look at a community and be on the outside of it and propose solutions, and the government would enact them. And the communities would say, oh my God, look at what this did. So many unintended consequences when you don't involve the stakeholders who are most central and key and impacted by the issue. So there was this incredible community-driven process, again, led by WePower, Tomorrow Builder Fellows, that involved the entire St. Louis region and community. Thousands of people's voices got to be part of this. And this was all about knowing the audience and creating allies and creating a set of advocates who could then be part of the process for proposing a policy solution. A really important group that was part of that came out of the IFF report, and that was the first step to Equity Collaborative. And I do want to recognize that a lot of our community partners and some who are maybe on this call were part of that effort. And so this was a really important step as well around organizing now, right? So again, we're not jumping straight into policy solutions. We're not jumping straight into what change needs to happen. We know that change needs to happen. Crafting how that change and how we create that problem-solving solutions, that's a very delicate process that should involve the community. And so it did in many, many layers. And then the role of research. So the role of research was always key, but we were pulling research in terms of like what was happening regionally, what was happening in sort of data. We needed a different type of research, and we needed the research that made the case for the vital importance of early childhood care and education and then the quality. And so then that's where the Clark Fox Policy Institute stepped in, and they created this, and of course I'm going to say that because I'm the associate director, but we spent a lot of time, and our partners know this, we spent a lot of time mapping out the research that said, why is ECE so critical? And why is it actually a policy solution, right? And not just a practice. It's not just about good programming. It's an actual policy solution. So first of all, what we found from the research and the science was the educational benefits are undeniable. The health outcomes and behaviors were things that people hadn't been thinking about, but for the sake of all was telling us that health was connected to this. And then there was the economic prosperity and community vitality, everything from lower rates of justice-involved adults, lower rates of teen pregnancy, higher rates of being able to earn income, living wage income as an adult, all tied to high-quality early childhood care and education. So this is the role of science and research in creating a policy solution. But first, let me just talk to you about the translation piece. So you might get a kick out of this. If you're reading this slide, on the left, I have just this excerpt, this tiny excerpt from a research study that was conducted. And I had to pull this excerpt out because if you read everything, you're like, I think I know what it says, but I'm not sure, because they're talking about gray matter and they're talking about percentage points and they're talking about the poverty level. And then we take that, and as translators of research, we said, what it means for the audience that we're talking to is that healthy brain development in children is associated with school readiness skills, okay? It's not always that simple, that translation, but that's what we're talking about. We're talking about taking that language that we just talked about that maybe academicians and scientists speak, and making it relevant in the story that we're telling our stakeholders and policymakers. We have another example of that where, so this one is, we didn't reduce any of the words. It's probably just as many words, if not more, but it's still the idea of, one is a very sort of scientific way of looking at this, and the language reflects that. And the second, and the translation is, but what does it mean for us, right? It means high quality birth to 5 programs for disadvantaged children. Now we're talking about equity, deliver that 13% return on investment each year in their lives, okay? So we brought everything together. I mean, so I want to go back to, again, if you want to start with For the Sake of All being released, that report being released around 2014, and we are now in 2020. And the story really starts way before then. But for the sake of the class, the story starts with 2014. We're going to bring everything together now that we've learned over the course of these years. And we're now ready to make some policy recommendations and think about the role of policy, evidence-based, research-informed policy. And we came up with 3 recommendations, right? The collaborative, the groups, everyone was involved could agree on these very key set of recommendations around increasing access via sustainable public investment, as well as private, but public investment is the policy piece. Prioritize an allocation of funding so that it goes to the children in the highest need and most impacted by poverty. And then system coordination, that we would have an entity that would help to improve the system, connect the system, regulate the system. And all of that then built up to a group coming together, some of the same players who had been part of the story all along, coming together, these collaborators, and they built a campaign, and it's called Ready by 5. And it's a campaign with and that campaign comes down to one very specific policy proposal, and that's to fund access and quality improvement initiatives for early childhood programs through a 0.5-cent sales tax. Okay, so you saw us move through this process, and it is really a process where we're translating the research, we're including the community, everyone is part of creating a policy proposal that we can get behind that will address the original problems we were seeing, right? That problem identification with quality, access, and coordination. So this is a story of a local case study of where we're seeing the role of research, practice, and policy, and we're seeing community-driven policy making. So now I want to introduce this framework called the 5 A's, and I want you to be able to maybe reflect on this case study in terms of the 5 A's. The 5 A's is really a tool around how we translate research to policy, and it's a guidance really. So A is know your audience. If our audience was the federal government or the state government, that process in our policy proposals would look very different. But at some point we realized that our audience was regional, and it was something that we could do right here in the region. So you have to know your audience. So then you have to know, how do we appeal to them? How do we talk to them? The allies and the advocates came in the form of when this became a really community-driven process, we started really being able to see who are our allies and who are our advocates. And WePower played a huge role in that, in actually training and helping people cultivate those skills around being allies and advocates. Framing the approach is really important because this goes back to what Dan was talking about, the windows, the stream of windows. It has to do with time sometimes. It has to do with momentum. It has to do with opportunity. And there was a lot of momentum and traction, and we were able to build on that. And then there was an issue around time, and this being the time frame. Of course, the time frame changed with the introduction of COVID-19. So we're going to see a lot change in terms of the political landscape this year. But our approach was very relevant, very timely. And then the products that I highlighted, again, we're storytellers, we're humans. If we're not telling the story, we're listening to it, okay? But we are a part of these stories. And we have a lot of ways in which we convey our stories. The content is conveyed in a lot of different ways, but no matter what the content is or no matter what vehicle it is, it has to be accurate, it has to be accessible. And last but not least, gets to that very specific, is there an actionable recommendation at the end of this? Is there an ask? And looking at the years-long process of identifying early childhood education as a real problem, but also a real opportunity for creating equity and building up our region, that campaign, the Ready by 5 campaign, had a very specific ask. And before I turn things over to Dan, I just want to introduce, this is part 3 of our segment now, and it's called Research as a Tool for Change. And we want to frame it in this way of A, accessing resources, B, building relationships, and C, curating content. And Dan's going to take it over and he's going to really help you understand what the ABCs of research as a tool for change mean.
Great, thanks, Atia. And folks are going to wave their arms wildly if my sound goes in out again. Thanks for bearing with me. So just to walk us through, so accessing resources. So really thinking about here, what's available to you. I mentioned earlier, one of the reasons to use a methodology or a framework is really rooted in this idea, that there's so much out there. And so by using some kind of analysis method, you can look at across journal articles, conference proceedings, government documents. We have bolded here in bright red font, all capitals, relationships, because we can search on our own, but then very oftentimes it's the relational connections that we're making with one another, with experts in the field, with advocates, with people with lived experience, which can really help to inform the work that we're interested in doing, not just understanding it, but then how to communicate it. We have a couple of examples here. Now's about the time, if we were in person, that we would encourage people to leave their cameras and their cell phones in their pockets and not rush to take pictures of the screen. All of the slides will be made available afterwards in these resources as well. But what we did want for folks just to take away from this is an idea that all of these materials are available publicly, and they have some great filtering functions. While not every single article that's published by all means is available for free, there's a lot out there that is. And then in instances where an article or something isn't available or it's behind a paywall, almost always you can get the summary and the abstract, and that's where we start to also look to other think tanks or other organizations that take troves of information and peer-reviewed information, peer-reviewed articles and research, and synthesize and summarize them for everyday use. So when you are looking at resources or articles, or maybe even thinking about what kinds of analysis you'd want to do at your organization or as an individual yourself, a couple of just things to keep an eye out for, and a couple of things. Commentary and opinion pieces are great. They give a lot of context. They can help with our framing, but what we're really looking for here is evidence. So you could look for policy surveillances and state scans, tracking of legislation, literature review, and a few other humble things. Looking across some of these pieces are just different ways of thinking about and understanding systems and structures, helping to, when we've identified a problem, how do we really start to identify alternatives and put forward recommendations, and then synthesize that into action. A little bit of relationship building also happens in terms of stakeholder analysis. So I would offer that, if we each wanted to kind of imagine ourselves or our organizations as this kind of center circle, in this wheel or in this hub, think about who are the people that you're providing information to, and the people who are in relation with you that provide information back bidirectionally. Vice versa, as a helpful stakeholder analysis, you can also think about either a policymaker or another organization, and think about if they're the center of the hub, where do you fit on their wheel? And think about where the different sources of information that they might be getting, and what's your unique niche, or what's the unique voice or perspective that you're bringing to the policymaking table. And speaking of the policymaking table, we wanted to highlight something that Brown School alum, former representative and current policy director for the St. Louis County Executive Office, Cora Faith Walker, has said, which emphasizes looking at facts, evidence, numbers, and statistics in policymaking decisions. But how does Cora get that information? So I've really enjoyed following the work of Jenny Owen over the last few years in particular. And she's the Director of Strategic Partnerships for Governor Roy Cooper, but she came into that role as faculty and Director of Policy Engagement at Duke University. And so what Jenny kind of is offering to the conversation here is policymakers don't just need kind of dumps of information, they need really thoughtful engagement around what's needed, when it's needed, and in a format that's best used. And so Jenny also talks really nicely about this idea about offering to be helpful and being helpful. So if you take what Cora has said, about the importance and use of data and statistics in policy decision making, and what Jenny is saying in terms of, being strategic about, how and when you're engaging, we think that's a great formula for success for informing and influencing the policy process. We also have a synthesis of the P's of engaging policymakers. So just a little bit of framework and something to keep in mind for how you could kind of think about not just strategically, but then actually how do you approach meeting with and engaging with policymakers. And I don't know if Tia, you wanted to chime in as well.
Sure. I also want to just recognize that the lovely woman who spoke to you at the beginning of the program, Sara Brown Russell, she is in this shot, as well as a Brown School alum. I want to say that Sara was, she worked in the legislative team for Senator Gillibrand. And so she really helped inform this piece around engaging policymakers because she worked with one for an entire year of her career. And so here's the thing. Policymakers need our intel. They need to hear from practitioners. They need to hear from the people who are impacted by their policies. They need to hear from researchers and academicians, just like Dan said. So you have to be proactive in establishing a relationship because the window of opportunity may be really small and you don't want to all of a sudden just push something through and they don't know who you are. So it takes a lot of time to build that relationship, but be proactive and look at what's coming up on the agenda, what's coming up for policymakers in the next session. And do you have something that will help to inform the policy that they're drafting and creating? And so think about being proactive. Think about your position. Your position is that you are a different type of resource and expertise, whether you said you aligned as a researcher or as a practitioner or as a more alignment in policy, your unique position is a resource to the policymaker. So think about how you can leverage that position. Point of agreement. So here's where, there's a lot of times where we don't agree on everything and we're just not going to. And we were vastly aware of that in the state of affairs today in our nation. However, there's a lot of places in which we actually have agreement. Look for that. That is your entry. Look for the point of agreement and look for the ways that you can be helpful in that point of agreement and say, listen, we actually both want families to have access to high quality healthcare. I'm going to start with that point of agreement, right? And then we have proximity. So you are proximate. A lot of times practitioners, researchers, we are actually proximate to the issues in a ways that policymakers are not. So use that proximity, use your perspective. All of us are lending a different perspective, whether we're educators or doctors or parents, leverage that perspective. It's unique and it's what gives you the edge. Public support. Well, I'm just going to say it. We vote for policymakers. We elect elected officials. So our public support, matters to them. So you want to leverage the fact that, they're looking for public support all the time. And then persevere in patience. I can't say this enough. This is a process. And you have to persevere and you have to have patience. There has been legislation that has come up again and again and again. And for years and years and years, it doesn't pass. It doesn't get funded, but you persevere and you stick with it and you have to. And Dan can give us a really great example about that.
So,
sorry, the Justice Bill. Sorry.
Oh,
I love your example about the Justice Bill, like how many years it didn't go with being funded, but it stuck around. So you have to persevere. Yeah.
Oh, yeah. Thanks. The reauthorization of the Juvenile Justice Delinquency and Prevention Act was without reauthorization from 2002 until just a couple of years ago.
Mm-hmm.
And so I think when Atia and I were talking just the other day in preparation for the presentation today, there's this idea of, walking and chewing bubblegum at the same time to have, your eye on some big audacious goal of, federal landmark legislation. But by no means does that mean that juvenile justice reform advocates and foster care system folks were just focused in on that, and that there weren't other conversations to be had or other policy change to explore.
Yeah. Okay.
So just jumping right back in. So in terms of curating content and communicating your message, there's no shortage of ways to get a message out there. And it'll take thoughtful consideration about who your audience is, remembering the 5 A's, obviously, into picking and choosing which of these makes the most sense for the messages that you're trying to convey. Very often it's a combination, if not all of the above, being done by diverse coalitions of stakeholders and community groups that are advancing and informing policy change. So, I'll just voice with an eye on the time and wanting to move to a hopefully robust Q&A and the questions that folks have, that some of the most impactful communications mechanisms that I've seen in my work have been a single image or a single slogan or a single fact or a single point. At the same time, some of the most impactful materials have been entire reports from a Surgeon General, perhaps, that have really been viewed or looked at as kind of these, seminal moments of policy change, that have opened up and changed the way that people thought about things. So this isn't to, say that one is better than the other. We actually looking at them very much in concert with one another.
Yeah.
And so again, just remembering the 5 A's, in particular about the communicating your message, accurate and accessible, I think are 2 of the big targets here, as well as thinking about the audience, which we can make in red in that bottom bullet. But that idea, again, just to lift up the case example that Atia offered earlier about localizing information, couldn't be more important.
Dan, I'm so sorry to interrupt. We're having some trouble with your sound again. It's popping in and out.
Okay, thanks for letting me know. Let's try that.
And just while Dan's doing that, I want to talk about just a little bit about accessible. Accessible just is very different. Like I may say accessible and it might be like a 7-page, paper or a 2-page policy brief. And nowadays accessible might be like a tweet or 2, right? So nowadays accessibility is a wide range of things, but think about who your audience is, how they communicate, what's important to them, and how you start with the place that feels most accessible to them, and then you continue to fill in the gaps. Yeah. And then I also want to talk about, there was a couple people who asked about timing and tips for engaging with policymakers. So timing is really difficult right now as we talk about policymakers always come to the session with a full agenda already, right? But they really are counting on their constituents to give guidance to that agenda. Most of them are. And so the time you spend building a relationship will really create the windows of time in which your practice or your research is going to be really timely. I don't know if that makes sense, but if I establish a relationship over time, I become a resource to a group of policymakers, a committee, a particular person, and then a window opens up for me to really be a more powerful resource and really interject and inform the policymaking process. So that's a little bit about timeliness. Tips around engaging during the pandemic. Oh my God, yeah, everyone has a very short attention span. Would love to hear from either Gary or Dan or even about, this pandemic is just unprecedented. So talking about trying to get their attention span right now, you have to tie it to the pandemic. And a lot of people are doing that. So when I talk about early childhood, we released our report in the midst of the pandemic, right, Gary? In the midst of the pandemic, we released the report, Launching Lifelong Success. And it was like, how are people going to pay attention to this? You know what? You're going to pay attention because the nation is about to lose almost 50% of licensed childcare spots because of what's happening with the pandemic and the fact that we don't have public funding. Now you're paying attention, right? So letting people know that we need high quality education care in childhood, telling people that here's the science behind it, letting people know this, and then saying, here's some policy proposals like this, calling for public funding. There we go. It didn't seem like that timely in a pandemic until, all of a sudden our essential workers don't have a place for their children to go, and the nation's going to lose maybe 50% of licensed spots. Back to you, Dan. Back to you. Okay. So Dan, you want to move on to the next one? Can we? Let's see. Can you hear us? Uh-oh. because we're going to wrap
While
up.
we're waiting for Dan to reconnect, why don't we just take a peek at some of these questions?
Yeah.
So Katie is saying we have had evidence and research along with the push for policy around topics such as ECE for many years, along with pushes for tax incentives to fund quality services. However, even when put to a vote, these don't pass, which I'm assuming has to do with timeliness. How do you determine when is an appropriate time to push policy decisions?
Yeah, I mean, it's really hard. It's not a perfect science, so there's no formula. However, as Dan mentioned before, there is some theory. There is some really some well thought out research, especially with Kingdom's when the streams that we can't cover today, but that really talk about actually how you maximize and do understand what are those opportunities. And sometimes the timing is nothing that you can predict at all. So when we talk about like vaccinations and things like that, who knew that we were going to have a measles outbreak, at Disneyland, in the last decade, right? But then that helped to push the conversation around what states are doing around mandating immunizations. So sometimes you have no idea and you can't predict what's going to happen. We definitely couldn't predict this pandemic, but it is a time for us to analyze a lot of the policies that support working families, such as public funding for early childhood education and care.
Yeah. And I'd just like to add too that, there are things that you should take into consideration when thinking about a political campaign. Like you should do polling to see if the public supports it, because you don't want to, it's a very expensive to run, political campaigns and ballot initiatives. So you want to make sure that the public is on your side. But I also don't come from the school that says outside of general elections, should we wait to approach a policymaker about changing this policy? Because if you wait for the stars to align, the stars will never align. And part of the policy process is to get the public discourse moving on any particular topic so that those stars start to align, if that makes any sense. Okay, we have a question from Nikki. It says, tips on engaging with different stakeholders during the pandemic when our attention spans and ability to meet are limited, especially in identifying and establishing new relationships when not able to meet in person. Ooh, that's a good one.
That's a really good one. Maybe one of the things you can think about again is, how do I be a resource? So right now, policymakers are trying to figure out how to connect with their constituents and how to stay connected. Offer the platform, create a platform for your policy. One of the best things you can do is, like, over summers when policymakers aren't in session, is to create opportunities for them to have an audience. Okay. So right now it's really hard. If you can tie this to the pandemic, if you can be a resource to them, if you can create a platform where they can reach out to their constituents, these might be ways in which you can help build that relationship.
It is a definite challenge though. Let's see. How about, I just want to let folks know that if you're interested in policy, that there is a fellowship that is about to launch through WePower, the Power Building Academy and Chisholm Chair Fellowship as well, which is for Black and Latinx women interested in running for elected office in 1 to 5 years. I would love to see that. And also there is the Power Building Academy, which is a policy fellowship, which you can find information about on WePower's website. Okay, let's see. Any other questions? Let's see. So Lina says, I love the point of agreement strategy. Do you have any other tips specifically for navigating the process of translational research, information dissemination in this politically polarized time, especially with anti-science movements gaining popularity? My interest is in sexual health and education, which is a pretty polarizing topic.
Well, that's a whole nother session, but I will quickly say that part of it is the lingo. Let's not call it science, okay? If there's a way that you can find out some very specific things about a policymaker's constituency base and what's happening in their community, there's going to be some consensus around who we want to protect. Where we're going to diverge a lot is how and what types of laws do that. So it's difficult to answer this question, but believe it or not, some of the best ways to support this process is to think about what the what the opposition is doing and saying. And so if you have legislation that is typically not supported by a certain party, build a relationship that says, why not? Understand why. And then think about looking for an alternative point of agreement and where we, you know, this is difficult. And it really, this one was, oh man, you put me on the spot.
Well, let me jump in here, Atia.
Yeah.
And that is, I mean, I think the best way to engage in conversations, you know, across this political divide is to ground that discussion in a set of shared values. And so if we use early childhood education as an example, there are a lot of values on the right and on the left that are completely aligned with making sure that kids have what they need for proper, you know, social and emotional development. And part of that is family strengthening and family value. Part of that, both, regardless of what your political affiliation is, you care about families, family strengthening and family values, and ECE falls within that value. It also falls within a more economic argument. As we make our way out of a pandemic, the only way that we're going to be able to get this economy moving again is if parents have the supports to bring their children someplace that's safe, that cares about their emotional and development well-being, that they can then re-engage with the workforce in a way that allows them a peace of mind during the day, knowing that their children's needs are being attended to. So those are values that, regardless of whether you're a Republican or a Democrat or a libertarian, generally speaking, those, you want to look for a set of common values and then build your message on those common values. I would say, but this as a director of a policy institute, that the argument still needs to be grounded in science, because if you push forth a policy initiative that's grounded in an ideology, regardless of what that ideology is, the chances of its success are grossly diminished because it's not built on a foundation of empirical knowledge. I hope that was helpful. Let's see. Yeah, Charlene is chatting away, lots of opportunities in there. I want you to please keep that information going, and we will also include that information in an email that we'll send out to attendees. So any other closing thoughts that you'd like to share with us?
So I'm gonna try to share my screen. Oh, we're back. Hey,
Hey everyone.
Yes.
Sorry about that. Tried to fix the audio and make it better, and it catastrophically made it worse. But in policy work, like we say, and in research, you roll with it. So just a couple of closing thoughts, and then we can just wrap things up. But so thinking about, unless Atia's already covered these slides while I was adjusting the audio.
Not yet.
Research and policy can be long, intricate, complicated, nuanced processes. And in addition, one of the things that the way that we like to think about translating research for policy and where they come together is that the effective translation of research into policy can provide that punch for influencing and informing the policy process. So we're truly grateful for everyone participating here today in Open Classroom and for bringing their work and their ideas and their thoughts to this discussion, and then to the work that we'll all be leading forward as we move forward from today.
I just want to reiterate a little bit about the patience and the perseverance and sticking with this. And some of you asked about how do you become that translator? And it takes time. It takes time. One of the best ways to become the translator is to work with other translators. So we invite you to the Brown School. There's a lot of offerings we have along these lines, and we want to bring you into our community and learn from you, and you learn from us. And the other thing I want to leave you with is, so policy making is not static. Research is not static. It's changing all the time. But policy is a way to sort of freeze power in place and freeze protections in place. And so we do need to stick with it. We need to stick with being part of the process. We should always see ourselves as a player in the process. If you are a change agent, then you are in the policy making process in some way, form, or shape. So please see yourself. Please feel empowered to be that player in this space. We definitely need more research in the policymaking arena, and we definitely need the communication between policy practice and research to be a little more seamless and a little more rapid, the way we're seeing it right now during the pandemic. And with that,
I want to thank you, Dan and Atia. This has been incredibly informative, and we can tell by the positive feedback we're receiving through the chat feature. And I also just want to, my own closing thoughts about this argument is that, as valuable as the research and data is, we have to recognize the systems in which that was created, which is why having a community engaged process is so critically important. You need to bring in the lived experience of those from the community who would be on the receiving end of any given policy and have them weigh in and help shape it. The empirical data is going to take you to a certain place, but you must then take in the lived experience in a way to kind of counteract a lot of those oppressive systems that have kept particularly voices of color from really being able to engage in research and engage with the academy. So that's why I'm so grateful for our community partners that work with the Clark Fox Policy Institute, and WePower, among them, as well as Ready by 21, and the providers such as Southside Early Childhood Center and Urban Sprouts and United Way and so many others. So
Ford through Ferguson.
And Ford through Ferguson. Absolutely. So they have really done an amazing job of pushing equity to the forefront of the policy discussions in the region and are serving as an example nationally. So thank you, Atia. Thank you, Dan. Thank you, Janet, for always doing your amazing behind the scenes magic. And we look forward to seeing you on Tuesday. And Janet, what do we have coming up on Tuesday?
That's right. So this actually represents the 10th and final of the first group of open classrooms. This was the finale of the first set of programs that we pushed out, but of course the response has been fantastic. And the other thing is many of us are still home. Our campus is still physically closed. So open classroom rolls on. And if you haven't been on our free resources page recently, please check out what we have coming up, because we have programs now running through early July. Hopefully brighter days for many folks by then, but lots of great opportunities to connect and engage with the Brown School, including on Tuesday, May 5th, Cinco de Mayo. We've got a housing advocacy during the COVID-19 crisis, which is going to be presented by the Brown Schools and Molly Metzger, partnering with Jackie Langham from Arch City Defenders. So you'll definitely want to check that out, and please come visit our webpage and sign up if you haven't already, so you'll get the link. So glad everyone could be with us. Please stay healthy and safe, and we hope to see you at Open Classroom next week. Take care, everybody.
Bye.